Hi, I'm Carolyn, Trichologist at Absolique Hair Health Clinic. We're going to share with you our consultation and diagnosis service, which is called a Hair Health and Scalp Check. So what we want to do is uncover with consultation forms, blood tests, and also microscopic diagnosis the symptoms and the causes of your individual hair loss, hair thinning, and we're also looking out for scalp conditions as well. So I'm a trichologist, as I said, that is a hair specialist. A dermatologist is a skin specialist, and they generally offer more medical type treatments, and they may do a scalp biopsy, which is removing a portion of the scalp to give you diagnosis. Whereas these days, trichologists can use our digital microscopes, so we can actually use a non-invasive tool on the scalp to then be able to see and blow it up microscopically so we can read what's actually going on. So what we're looking for is comparing the terminal area, which is the strongest, thickest area of hair on the head, to see how is the hair growing here, which tells us about the hair cell, the state of the hair cycle, and then we can actually compare that to other areas. So we might be dealing with different forms of alopecia, or we might be looking at in the recession areas. Up here we can get pattern thinning, so we've got female pattern thinning and male pattern thinning, so we need to determine exactly what is happening for you. So sometimes you think that something might be happening at the front because that's where you can see it, but we need to uncover how things are actually growing at the back as well. And then we've got different scalp conditions which can move all around the scalp. So once we've got our diagnosis using the microscope, we sort of move around all over the scalp and show you what we're seeing, we then can offer you treatment options, okay? So the diagnosis will determine what treatment we offer, but we do try and be more holistic in our approach because we try and avoid the common side effects. So you've got to be very careful about what you read online to don't just stop and try things if you don't actually know the science of what's going on for you. So I just want to cover off on a couple of commonly asked questions. You don't need a referral to come and see me as a trichologist, but what we do is considered to be cosmetic. So you will not be covered by any Medicare or any health insurance, unfortunately. We look at your past blood tests because it might help to uncover the cause. And you also write up a bit of a history for us. As we said, the treatment options, I can't say what they will be unless I know what's going on. So you may see that there's a hair loss or hair thinning problem, but there might be underlying scalp conditions that we have to be aware of as well. Always start with a correct diagnosis, individual treatment options to suit your circumstances, and understanding the cause. So just say you have current hair loss and we figure out why it's happening. Sometimes that's all we need to do. Check bloods, make sure things are in order, and on you go. But other times we may need to offer some treatments to stabilize things or do some prevention as well. So it's a very full session. It takes about an hour and 15 minutes. We do it in Brisbane, we do it in Sydney, and we also do it on Skype all around the world. So it's our Hair Health and Scalp Check as always. If you've got questions or you want to share your story, please drop me an email. It's info@absolique.com.au.